Sleep disorders: insomnia, sleep apnea, and circadian rhythm disorders. What is a sleep disorder? Sleep disorders contribute to the broken up sleep, shorter sleep time, and/or impaired sleeplessness. Insomnia is characterized by difficulty falling asleep or staying asleep, which contributes to daytime damage or noticeable stress. How insomnia can affect you. The persistence of insomnia can contribute to injuries and illnesses, as well as harmful effects on relationships, concentration, ability to handle stress, and productivity. Some of the most common phrases associated with insomnia are, "I can't ever seem to get to sleep at night," "I wake up every morning before the birds," and "I can't get any work done during the day. I'm always so sleepy." This is the most common adult sleep disorder and can cause insufficient sleep, even if there is enough time to sleep. Diagnosing insomnia is based on a thorough sleep history. Determining the cause and extent of insomnia includes questions such as, how long does it take you to fall asleep? How long are you able to maintain sleep? And how do you feel the next day? Alcohol usage is a major part in diagnosing insomnia because it severely disrupts sleep, especially if it is consumed right before bed. Treatment options for severe or long-term insomnia can include behavioral interventions or pharmacotherapeutics, the study of therapeutic uses and effects of drugs, or a combination of both. Behavioral change is the first part of breaking maladaptive sleep habits. When interventions such as keeping a sleep schedule, creating a dark and comfortable environment, and having pre-bedtime activities become useful, insomnia can be resolved without drugs. Sleep apnea. A common problem that affects a person's breathing when one is sleeping because air cannot flow normally in their lungs. This is caused by soft tissues that fall down in the back of the throat, upper airway, and tongue during sleep. Apnea means a pause in breathing for at least 10 seconds. This disorder is the most common in men, women after menopause, and people over the age of 65. So who's at risk? Those with enlarged tonsils and/or adenoids, a family history of obstructive sleep apnea, excessive weight, obesity, or jaw problems such as micronathia, small jaw, or retronathia, a pulled back jaw. Sleep apnea symptoms during sleep. Loud snoring that bothers others around trying to sleep, gasping or choking sounds, breathing pauses observed by someone watching you sleep, sudden or jerky body movements, restless tossing and turning, or frequent awakenings from sleep. So what about when you're awake? Waking up feeling like you had inadequate sleep, morning headaches, dry or sore throat from breathing through your mouth during sleep, sleepiness during the day, or personality changes, also known as mood swings. Sleep apnea in children. This is characterized by repeated events of partial or complete upper airway blockage during sleep, which results in the disruption of normal gas exchange and sleep breakups. Snoring is a frequent symptom during childhood and has been reported by 27% of children who are affected occasionally. 7 to 12% of snoring has been reported by parents who hear their kids 3 or more times a week. Symptoms in children are usually hard to recognize, but the nighttime symptoms are snoring, noisy breathing, snorting episodes, paradoxical chest and abdominal motions, sweating, recurring nightmares, and restless sleep. Children with nasal congestion will often overextend their necks and open their mouths to breathe in order to minimize snoring. The daytime symptoms include mouth breathing, difficulty in waking up, moodiness, morning headaches, nasal obstruction, daytime sleepiness, hyperactivity, and cognitive problems. So who's at risk for sleep apnea in children? Children who are overweight or have genetic syndromes, for example, Down syndrome. Children who have an abnormal face or throat, for example, having a small chin or throat, a large tongue or cleft palate, a hole in the roof of the mouth. Family history. Breathing control. Problems in the brain can affect a child's breathing during sleep. Treatment for children with sleep apnea. Weight loss. Finding effective weight control programs. Sleeping position. Laying on the back when sleeping is actually worse for breathing, but laying on the side with pillows helps to elevate the body for better air circulation. Treatment for allergies. Allergies can cause swelling in the nose, which makes sleep apnea worse, so seeking medical treatment can benefit the child. Circadian rhythm disorders. Circadian rhythm is a 24-hour internal body clock located in the brain that cycles alertness and sleepiness. These disorder types include delayed sleep phase, advanced sleep phase, irregular sleep-wake phase, free running, jet lag, and shift work. Delayed sleep phase syndrome is the most common circadian rhythm disorder. It is normally seen in teenagers, even though it can start at any age. Those who have DSPS have trouble keeping a normal sleep schedule since their sleep and wake time is later than the desired time. The outcome of this is shortened sleep time, which can lead to problems in work performance, school, or social interactions. So what are the symptoms? One of the most common symptoms is falling asleep, but there are no problems staying asleep. Trouble waking up at a reasonable time. This can lead to problems at work, school, and can lead to depression. However, when a person gets adequate undisturbed sleep, he or she will feel refreshed after waking up. Advanced sleep phase. This is characterized by early evening sleepiness, involuntary onset of sleep, and wake-up times that are very much earlier than the desired time. This is the most common among older adults and middle-aged people. The diagnosis mainly relies on the history of severe early evening sleepiness and early morning insomnia associated with functional impairment or stress. Irregular sleep-wake phase. This is characterized by a lack of a clearly recognized circadian sleep-wake rhythm, in which sleep-wake periods are distributed into 3 or more short times, lasting 1 to 4 hours throughout the day. The diagnosis is made by the clinical history of fragmented sleep and wake periods, along with severe complaints of insomnia and excessive sleepiness. The most effective treatment is a combo of structured social and physical activity, exposure to light during the day, and minimizing light and noise at night. Non-entrained, also known as free running. In this condition, the frequency of the fluctuation of the body clock in humans is a little longer than 24 hours. Therefore, the sleep and wake times will be later each day. Since light is the strongest synchronizing factor of the circadian clock, most patients with non-entrained sleep-wake cycles are blind. It has been noted that approximately 50% of blind people have disturbed sleep. A treatment that combines sleep hygiene education, regular sleep and wake-up times, and structured social and physical activities should be encouraged with all individuals with free running disorder. Jet lag. This is characterized by both nocturnal sleep disturbances and impaired daytime alertness, along with other symptoms such as restlessness and distress. The intensity and length of time this can last depends on the number of time zones crossed, the direction of travel, the inability to sleep while traveling, the availability and intensity of local 24-hour time cues upon arrival, and individual differences in tolerance to the 24-hour misalignment. In professional travelers such as flight personnel, diplomats, and international business executives, jet lag may be recurrent or severe. And last but not least, shift work. Characterized by complaints of insomnia, excessive sleepiness, and impaired performance that happens when work hours are scheduled during the usual sleep period. One of the main physiological problems associated with shift work is that working, eating, and sleeping phases change. Shift work can cause anxiety, depression, and neuroticism, increased risk of low birth weight, spontaneous abortion, and prematurity. Dealing with potentially harmful work schedules involves helping people cope and composing schedules that cause the least disruption to the mental, physical, and social well-being. The rest of the slides are pictures of insomnia, sleep apnea, as well as circadian rhythm sleep disorders. And to end with my references. This was my PowerPoint presentation for sleep disorders for my health psychology class for Dr. Michelle Green. Thank you.